Hi, everybody. I'm Scott, and thanks for joining us today for another episode of the In Medicine and On Medicine podcast. This is Susan. Hi, Susan.
Hi.
Susan is an Oriental medicine doctor and East Asian medical practitioner here in the Las Vegas, Nevada Valley. Her information comes across the screen every so often. If you'd like to get in touch with her with comments, questions, or to make an appointment, which you may also do so in the comments section below, and we'll try and get answers to questions back to you as soon as we can. So today we want to try and answer the question, is chronic pain a life sentence? And hopefully the answer is no, Susan. So why don't we start with the basics? What is chronic pain? What causes it? How common is it? All that fun stuff.
Okay, so chronic pain is usually described as pain that is present more days than not, that people suffer for at least 3 months. Okay, I mean that's like the technical definition, but the real definition, or what people's experience is sort of nagging pain that goes on and on and on, and sometimes this pain can go on for 3 months or 6 months or a year or years.
Okay, tell me, what's nagging mean? I mean, are we
That's a
talking
good
about debilitating? Like what?
No, there's something called high impact chronic pain.
Okay.
High impact chronic pain interferes with everyday life activities.
Okay.
So pain that makes it hard to work or hard to walk or hard to just perform the activities of daily living. There's pain that interferes with that, or
Okay, so
people that
this
have so
isn't-
much pain they can't sleep, or
Right,
something like that. So there's chronic pain where people can still function even though they're not very happy about it, or there's high impact chronic pain which they can't even function. I mean,
Okay.
for example, I have a patient right now who's on disability, who has had numerous back surgeries and has pain all the time, and has a pain doctor because she's on multiple pharmaceuticals. And for her, it's more about managing the pain than it is curing the pain. Does that make sense?
Yep.
So that's what chronic pain is.
Okay. How common is it?
Oh.
And how common is it today compared to when you started? Have you seen a change, or it's
Oh, that's a
steady,
good
or-
question. You know, this is just my opinion. So, but because I never thought of it that way, I would say, I would say that people are more likely to seek help for it now.
Okay.
However, not necessarily here in Nevada. Because my experience in Nevada is different than my experience practicing in other states.
So there's a couple of things I think of in that regard. There was like the period in the 70s and 80s when we got much more active and whatnot, and the rise of the health club and whatnot. But then there's also now where you have all this technology and all these gadgets and whatnot that supposedly help make you, more fit and recover better. And I just wonder how much of it is real and how much of it is not. And at the end of the day, when you get to a certain point, your body is going to present itself as with pain in one way, acute or chronic in one way or another.
Well, I can't really speak to that. I don't know. That would be something that we would have to Google. Like what is the what percentage of people have gym memberships or something like I can't talk about it. I don't even know what direction that is. So one thing about chronic pain is the National Institutes of Health, right? Who's at least in the past was really good at giving us statistics we could actually put some faith in. Said or has identified that chronic pain has been increasing in the general population faster than any other chronic health problem, faster than diabetes, faster than heart disease, faster than anything. So more and more people are reporting that they suffer with chronic pain as the years go by.
Okay, so that's a yes to my earlier question.
Yeah. I think it is. I think it is.
Increased, yeah.
Right. So it is increased. And then the other thing about chronic pain is that when people with chronic pain are interviewed a year after their diagnosis, something like 2/3 of them say that they still have their chronic pain.
Oh God.
So what does that tell you? I mean, it tells you that as a society, we don't handle chronic pain very well. And what is there really to offer people that are suffering from what we call chronic pain?
So tell us a little bit about how Western medicine has approached this, and then we'll get into alternative.
Okay, so what does Western medicine have to offer? Well, the big thing that they have to offer is pharmaceuticals. Okay, and pharmaceuticals have their place for sure. Over-the-counter medications, acetaminophen, Tylenol, NSAIDs, non-steroidal anti-inflammatory drugs, like aspirin or naproxen, address inflammation, right? Which is a part of the whole chronic pain constellation of things. They also use anti-anxiety medication like diazepam or antidepressants like Celebrex that have been shown to be effective against chronic pain or with chronic pain. Stronger painkillers, oxycodone, OxyContin, fentanyl,
Okay, so the worse
codeine, that kind of thing.
the worse the pain, the less pretty the treatment seems to get here.
Well, and this again is just my opinion.
Okay.
Okay, this is my opinion. My opinion is that when people take pain medication for a long period of time, that it actually encourages, it actually, or this is just what I've seen, it tends to make them more sensitive to pain.
Okay.
It's kind of a self-fulfilling kind of prophecy that it. So my personal opinion is that pain medication, especially the strong pain medication, should have a limited prescription time.
So the longer use, by numbing it longer, you're actually making yourself more susceptible.
I think you're making
to the
people more
slightest thing.
more sensitive to pain, because it seems to me anyway, just practicing for 25 years, it seems like when people get into this cycle of taking pain medication, especially pretty heavy duty pain medication, they become either and I don't know if this is physiologically the truth, or I don't know if it's psychologically the truth, but it definitely is something that you see, that people become hyper vigilant to everything. And so like years ago, like a long time ago, before I even studied Chinese medicine, so longer than 25 years ago, I worked at a pain clinic. And it was a very interesting experience because back then, and this is, back in the dark ages, people got, patients got sent to the pain clinic usually by the court or by, like Labor and Industries or something like that. And when they showed up at the pain clinic, they thought that they were going to get medication, but no, that was not what they were going to get. What they were going to get was they were going to get a team approach to getting them off the pain medications. And it was pretty brutal. Well, first of all, many patients walked out the door.
I'm sure.
They just were like, as soon as it dawned on them why they were there, they were like, absolutely not. And they were out the door. But there were some real successes where people, and there was a clinical psychologist, a physical therapist, a massage therapist. So they did like psychological counseling. They did soft tissue work. They did physical therapy. It was a very concerted sort of team approach.
Just working the body from the inside out.
Exactly. And there were successes. There were some, it was very interesting. There were, the people who immediately left. There were the people who, and also I remember years ago, somebody said to me, these chronic pain people, they're all philanderers. They're all making it up. I didn't see that. I didn't really see people that I thought, okay, these people are just drug seekers and this isn't real. I mean, I maybe saw one or two out of many people. So that really wasn't something I personally saw. We also saw people that had were misdiagnosed. I remember.
Oh, I've had a lot of that.
Oh yeah, like I remember there was one person, and I was just a massage therapist at the time. I was like, I didn't know anything, and I remember being with this woman who had an episode, and I remember looking at her and looking at her body and saying, okay, I'm seeing something and I don't know what this is. And I had to go to the doctor, the medical doctor, and describe it. And I said, this is what I saw that she did while she was having this episode of severe pain. And he was like, oh, this is a seizure disorder.
Oh.
And she ended up going down a completely different path. She had some kind of issue going on that was not chronic pain. It was something completely different. So a couple of times things like that happened where it was something completely different. But there were also successes where people, worked, they did it, they worked the program, they got off all of their pain medication. And did they still have pain? Yeah, but they just managed it in a completely different way. And they managed it without pharmaceuticals. And their quality of life was like so much better. So those were like big successes. So it was a really great experience for me. And it actually inspired me to kind of go and get more training and
Right.
become, like a medical professional.
Okay, so now let's start. Now let's bring it into your world and tell us how does Chinese medicine? How does?
Let me say one more thing.
Okay.
So they've got a lot of pharmaceuticals, but they also have like big guns, right? They have like nerve blocks, or they have computerized pumps where people can administer their own pain
Yeah, you
medication.
see people walking around ports doing that and stuff.
Exactly. Then they also do trigger point injection therapy.
What is that?
So I don't know when Travell did this. Was it back in the 90s? Anyway, there was this woman, she was a physical therapist, and her name was Travell. I forget her first name. Anyway, she had a team of people, and they identified these things called trigger points. So we might be able to find a picture that we could put up on the wall. So there's these things called motor units.
Called what? I'm sorry?
Motor units.
Okay.
So a motor unit is a bunch of muscle cells that have the same nerve. Okay, so the same branch of a nerve goes and it attaches to this specific group of muscle cells. And that one nerve stimulates this group.
Okay.
And it could be 200 muscle cells, it could be 2,000 muscle cells, but they're all together. Okay. So once in a while, something odd happens to that little unit, that little motor unit. And electrically, you can actually hear it because muscles have a electronic frequency. It's 60 cycle noise. You can actually hook up electrodes to muscles and hear it. It sounds like static.
Hi, Carol. Sorry.
Exactly. Hi, Carol. So, but what happens with trigger points is it becomes electrically silent.
Okay.
So you can actually, there's like tools where you can kind of go over the surface of the body and you can hear this 60 cycle noise, and then all of a sudden, nothing. And that's a trigger point. And you can actually, as a body worker, you can actually feel them sometimes. So they'll feel like a knot or like a bump or something. And when you press on it, you'll get pain and you'll also get referred pain. So what Travell did was she mapped out, and her team mapped out like every trigger point in the body, its location, and then where it referred pain to. So like, for example, like there's several, but there's like a big one on your shoulder blade in the back. And if you find it, and people will go, that's it. And you press on it, and then, you say, okay, does this pain radiate anywhere? And they'll go, oh yeah, it radiates up into my neck behind my ear. And it's like, aha.
But it's interesting how you don't feel it until you press on it.
Well, what they feel is that everything's tight and stiff,
right, but then
and it
you
doesn't
press on
work.
it,
And then you press on it, and they
feel
go,
the knot,
woo!
like you said. You literally feel
Right. And so what you do is you press on it, it becomes starved for oxygen, right? Because you actually are interfering with its circulation, and it lets go. And then what that does is it makes that referred pain go away. So I would press on the trigger point and go, okay, tell me when it stops radiating up into your neck and into your ear. And then they'll go, oh, it stopped. And it's like, okay. So what Western medicine does, is they do injections. And also I've been investigating, because in Nevada, it's within my scope of practice as an acupuncturist to do point injection therapy. And one of the point injection therapy techniques is injecting trigger points with either saline or with a painkiller like lidocaine, or even with a homeopathic remedy or with an herbal remedy or something like that. But the trigger points all go back to Travell, which has been around forever. right? So
So the injections are just a shorter route to addressing the problem as opposed to doing it
well,
manually, or is it something
as an
more?
old massage therapist, it's really great to understand how to work with trigger points because it makes your job so much easier. Otherwise, it's like the person comes in, 20 times because their neck and shoulder hurts and you're like beating your head against the wall.
Right, right,
And
right.
then you're like, whoa, oh my God, here's the trigger points. You fix the trigger points and then the neck and shoulder pain goes away. As a matter of fact, that just happened. So, uh, I have a patient who has a complicated diagnosis, but one of the things is that she has chronic neck and shoulder pain. And so, one of the first times she came in, I said to her, "Well, okay, let me deal with this neck issue." And I learned this so long ago that I don't remember where I learned it. But I did this cervical technique with her, which I learned somewhere, where you gently, it's not like chiropractic at all. It's not adjusting or anything like that, but it's just palpating the cervical vertebrae
Okay.
and identifying where they are a little bit misaligned. And then you do this little technique where you sort of encourage them to sort of slip back into the position they're supposed to be. And I'm talking like
Encourage as opposed to jamming it back.
exactly. Yeah, no, it's very gentle and we're talking like millimeters.
Okay.
Okay. And she looked at me and said, "I you just fixed my neck." Like it was like a drastic, sort of eye-opening experience and it was just this mild little technique that I learned 25, 30 years ago and she said, "Well, can you teach me how to do it?" And so I've been actually teaching her how to do it. But she also has this chronic shoulder pain. And so, one of the next times that she came in and I checked her neck and I'm like, "No, it's not the cervical vertebrae. This is something else." And so I went and checked the trigger points in her right shoulder. And sure enough, there were one, two, there were at least three. And so I did this basic massage therapy technique that I've known for a million years. The pain radiated up into her neck. That went away. And again, she stood up and said, "Oh my goodness."
I'm cured.
Well, yeah. I mean, and not to say anything bad about chiropractic. I love chiropractic. She said, "I've been going to a chiropractor for a few years, and this is now gone. Like it went from whatever it was, a 5 or a 6 out of 10 to 0 in less than 2 minutes."
Wow, cool.
But what was it? Why? Well, because I know how to work on trigger points. So it's very useful. And so, can people get help from Western medicine with injections into trigger points? Yeah, sure they can. Personally, I'd rather have somebody put their hands on me, but there is definitely a way of addressing chronic pain when it's related to trigger points with injection therapy.
Okay, that's a perfect bridge into. So now let's talk about how alternative medicine looks at chronic pain and diagnosing it and treating it and
I mean, and
towards
this
that.
is just my opinion based on what I've seen over the years, but the pharmaceuticals as a band-aid seem great, but as a solution don't seem like a solution at all. And people really end up going down a rabbit hole and it ends up being a big problem. I mean, that's again my opinion.
Okay, so how do you
So
look at it?
so yeah, so what does Chinese medicine have to well, we on other podcasts we've talked about there's this stuff called qi. It has its energy, it doesn't have a physical form. In Chinese medicine is an energetic medicine, and so what we believe is that the physical follows the non-physical. So for example, the blood, the red stuff, follows the qi, the energy. Okay, so it's very it's a theory or a philosophy that is very common in like the martial arts, right? The martial artist throws his or her chi, at their opponent, and their opponent falls down without them even touching them because it's the energy that's been projected, right? So so the Chinese diagnosis for pain in general is qi and blood stagnation, right? The qi and the blood flows through the body in these things called meridians in this really complicated way. And when it's flowing the way it's supposed to, you feel great. You don't have any pain. Everything's terrific. But when there's a problem with that flow, that's when problems arise. And so the go-to diagnosis for people that have, shoulder pain or neck pain or back pain or wrist pain or whatever kind of pain is chi and blood stagnation. The chi is trying to get through this area and it's not succeeding. And so it aches or it throbs, or if it's more of a blood stagnation, it can be like sharp and stabbing kind of pain, but it's definitely things are not moving. And so that is kind of the foundational diagnosis. Now, this just came up. Okay, so one thing that just came to my attention that I'd kind of forgotten about over the years is that in the country, okay, not here in Nevada. In Nevada, it's only one thing, but in the rest of the country, there's actually two ways that you can become a Chinese medicine practitioner. You can either study traditional Chinese medicine, which is what I did, which is usually takes 4 or 5 years, like after college. Okay. Or you can be an acupuncturist, which takes about 3 years. And one thing about the acupuncturists is they don't study herbal medicine. They just do the acupuncture. So acupuncture is an energetic medicine. That's what it does. It works on the chi. It works on the chi and the blood in the channels. Okay. So when an acupuncturist looks at a patient, they're looking at, okay, what's going on here? What channels are involved? What acupuncture points do I need to use energetically to fix whatever it is that's going on? Okay. TCM practitioners study herbal medicine, and herbal medicine makes people, we have to think of things in a different way. We do look at the channels and we do look at the energetics, but we also look at, okay, what's the underlying constitutional issue that made this happen in the first place? And that's a different kind of diagnostic thinking, okay? And so with chronic pain, many times, it's a channel pathology. There's something going on in the channels. So either an acupuncturist or a TCM practitioner would want to work in the channels. The trigger points that we talked about earlier are channel problems, okay? They're like little log jams in the channel, okay? But if there's some sort of underlying constitutional issue, like, for example, something we would call liver yin deficiency, which we can talk about what that is. The liver, as all the organs are in Chinese medicine, is like an umbrella under which there are many things that are contained. So, for example, the liver means the liver, but it also includes the gallbladder. It also includes the liver channel and the gallbladder channel. It also includes the sinews or the tendons and ligaments. So sometimes we'll have somebody with chronic pain, a musculoskeletal problem in their shoulder or their neck or their back or whatever. But when we take their pulse and their tongue, we realize, there's something going on in the liver system, and the liver rules the sinews and the tendons. So there's an issue that we have to address with herbs to fix that imbalance in the liver, which in the end will have a positive impact on this chronic pain problem.
And so it's that pulse and tongue differential diagnosis that will tell you whether the pain is right there or if it's a referral from something else, somewhere else in the body, or
it'll tell us that there's pain.
Okay.
Like the pulse for sure will tell us that there's pain.
So how do you know that it's an underlying condition versus
that's what
just
the pulse,
I have an injury?
That's
right
what
there.
the pulse and the tongue tell us. Okay. So that's what so the pulse may tell us that there's pain. It usually does. It usually does. The tongue doesn't really tell us about the presence of pain so much, but the pulse does. But the tongue and the pulse really tell us the condition of the internal organs. So, we identify that there's a pain problem in the body. We identify where it is. And, I've been talking about musculoskeletal pain, but it can be all kinds of chronic pain. Like migraines is a classic example of a chronic pain problem that people suffer continually over and over and over and over and over and over again. So
you just mentioned organ injury. So does the length of the chronic problem, the chronic pain, affect then the internal then when you.
Yes, that's a
So
good
the
question.
longer it goes on, the worse other things get, and
Yes. So we've got the channels and then we've got the organs. So yes, the longer things go on, the more likely you'll see either an organ problem become a channel problem or a channel problem become an organ problem. And then it's complicated, right? Because then you've got organ stuff going on and channel stuff going on. And had you caught it earlier, it might have just been one or the other, but now you've got both.
right.
So, oh gosh, I just saw somebody like a few days ago, and one of the things that she had was an organ problem, something that we call the spleen, which was not very happy. And I noticed when I was looking at her legs that in the spleen channel there was swelling,
There was what? Okay.
like I could see it right
Okay.
here, and I was like, oh, and so I was kind of poking around. And I was like, what does this feel like? And she said, oh, it's really sore there. I was like, an organ problem that had turned into a channel problem. And it was manifesting on the body where you could actually see it.
Interesting.
Yeah. So if she just said to me, my legs are sore and I just wanted to treat the channel problem, I might miss the boat
Right.
because it's a channel problem, but there's clearly an organ involved. So I clearly have to treat the organ as well. So, but that's thinking like an herbalist.
Okay, so where do you start? So where do you start with the treatment then?
Well, where I always start with the
And
treatment.
let me ask this so since we're talking about a chronic nagging type of pain, unlike something that's acute, you don't have to like deal with the pain first and everything else later, like you would if I came in and said, I'm in so much pain I can't even function. You just want to help me get rid of the pain first. But this is not that.
Well, I mean, you always want to help the people with what's forefront in their mind.
Okay.
So, yeah, like if I had a chronic pain patient come in who, had pain for a year or whatever, and they left and their pain was completely the same, well, why would they come back? I mean, I have to help them, I have to fix the problem.
Right, that makes sense, yeah.
And so what I do is, because a lot of times by the time people come into Chinese medicine, it's complicated, right? Because they come to us last instead of first, right? So, they don't come to us when they've had a pain for a week. They come to us when they've had a pain for a year. So it's complicated. So what I always tell them is, okay, how are we going to be able to identify that this is working? Intensity of symptom, duration of relief, right? The x-axis and the y-axis. So intensity of symptom. So if the worst that your pain is a 7 out of 10, then after this treatment, I want it to be a 4 out of 10. And then a 3 out of 10, and then a 1 out of 10, and then none, right? If you get some relief, okay, let's say you get great relief, like my patient with the shoulder and the neck pain. She had absolutely no symptoms for like 3 days. Okay, so you got 3 days. Well, now we want you to get 8 days, and then 16 days, and then 21 days, and then, none. So this is how I try and talk to people and how I want people to think.
So when you put it that way to the patient, they're able to communicate it in some way then afterwards.
Right, because it's really hard to notice when something's not there.
Because just telling you, oh, I feel better, that's not helping you.
That doesn't really help.
That doesn't help you at all as to where to go from here. You need a little more.
I mean, and that's why we use it's kind of silly, but it really works. Well, on a scale of 1 to 10,
right,
10 being as bad as it can be and 0 being 0, what is it now,
And with that, you're just comparing the person's answer to the person's answer.
Correct.
Because your 10 and my 10 might
completely
be very
different.
Okay.
Right. And so often people will say, oh, my pain is unchanged. Nothing's working. And I'm like, okay, well, what on a scale of 1 to 10? And they'll say, oh, God, it's terrible. It's a 5. And it's like, okay, well, the last time you came in, you said it was a 9. So is it changed? And then sometimes they'll go, oh, I said it was a 9. Now, sometimes they'll say, oh, it's a 9. I'm
right,
like,
because
okay,
they want to be in denial about the thing working.
Not most people know, but there are some people, and I think I mentioned a patient that I had who had terrible pain, and I know a neighbor of hers who kind of has filled me in about what's been going on with her, who came in with horrible pain and swelling in a leg. She came in, she could barely walk, and had just terrible pain. And she was waiting for her insurance company to approve some really expensive medical device. It was like $9,000 or something that was supposed to help with the swelling in the leg. And so one thing I did was I measured her leg, like,
Huh.
how many centimeters is your leg?
Right.
And there was a little bit of a difference. I mean, if people listening to this podcast measured their legs, they'd probably have a couple centimeters different, one leg to another. I mean, it's pretty common. And so it wasn't a dramatically different measurement, but to her it felt very big, which is totally legitimate, right? So, and she actually, I mean, you could tell by touching the legs that there was some tightness, a little bit of swelling in one of the legs. And so gave her treatment, and her pain was a 10 out of 10,
Okay.
which again, my 10 might be different. I mean, when I think of 10, I think of like getting your leg amputated with no anesthesia.
right,
I mean,
right.
or going through childbirth alone or something, something like so bad. But people, have their own perception. So she had said it was 10 out of 10. At the end of the treatment, I said, okay, well, on a scale of 1 to 10, like, what is it right now? And she said, it's a 0. And I said, it's a 0? Because that was kind of
Because that's almost
terrific.
as extreme as the 10 is. Right,
Exactly.
right, right.
And I was like, well, that's great. And she said, oh, can I just lay here for the rest of the day? And I was like, well, no, you can't. But that's really great.
Move over, lady.
Yeah, exactly. It might get crowded in here. But, and then she looked at me and she said, well, I still have pain. I just can't feel it right now. And I got to tell you, that blew my mind. I mean, I thought, what? Like I had never heard anything like that
Well, that's
before.
almost the wanting to wear like a crown, like a badge of honor type of thing.
I don't know. And it's because I know her neighbor. Her neighbor over the months has said, oh, she got that machine and it's not working. And and her pain is unchanged. And she said, I talked to her recently and she said, I'll do anything to get rid of this pain. And I said, well, that's interesting because, she was on my table and it was a 0.
Right.
But I mean, I didn't say that actually because, you can't say stuff like that. But I was like, oh, that's interesting. So that's sort of above my pay grade. Like
Yeah,
I
well, there's
can't,
nothing you can do about
I don't know how, I clearly did not reach her in some way. And I don't know why. I mean, I
Okay,
feel bad.
But
about
what
it,
that says is you don't only have to reach the patient, the physical patient, you have to reach the mental and emotional patient as well.
well,
with these
right, but like
treatments.
in Chinese medicine, there's really no difference. Like we don't really
Right.
think that there's anything really going on up here in your head, right? That your
Most of
psychological
us, there's
self,
not.
right? Like your psychological self
Uh-huh.
resides in your entire body, right? So yeah, we don't separate, we don't like artificially separate out the psycho-emotional part from the physical part. We can't do that. So yeah, so I feel like I did not I did not reach her. So yeah, even though the pain was gone, there was something else and it came back, right? So, what I would have said had I been able to continue with her is, okay, how long is this 0 going to last? And then let's try and move that out and get more and more. and
Okay,
more.
so which then sort of leads to like, if you make your axis 3-dimensional, there's the relief of the pain and the duration, but then there's how long is the whole thing going to take to get to 0 or whatever, close to 0.
Well,
we're
yeah,
going to
and we
get.
don't really know that.
Okay.
I mean, all I can do is make an educated guess. So, like, for example, I just had a patient who was in a car accident, and I don't do insurance work anymore. I mean, I did insurance work for 17 years, and finally it just got too awful, and I just couldn't bear it anymore. And that was before I moved to Nevada, and Nevada's even worse. So, but this woman, I had worked with her, and I knew her, and I like her, and I was like, okay, whatever, sure, I'll do it, and so her attorney called me and he said, well, how long is this going to take? And I said, when she came in, I did a differential diagnosis and a treatment plan, and my treatment plan was that I was going to need to see her twice a week for at least 6 weeks, and maybe at that point, maybe once a week for another 6 weeks. I said, but I just saw her for her second appointment, and the difference, the change in her symptoms is so dramatic that I don't think she's going to need very much treatment at all. And I said, I think I'm going to need to see her twice a week for maybe 2 or 3 weeks, and maybe once a week for maybe 2 or 3 weeks. And that's actually what, and he was like, oh, okay. And that's actually what ended up happening. I mean, the last time I saw her was in January, and she hadn't had any symptoms in 19 days, like none. And I was like, okay, well, you're done. There's nothing else to work on. If it comes back, give me a call. But so we don't really know. When I first saw her, I really thought, oh, this is bad. I mean, because she had so many different things going on, and I just was like, oh my goodness, this poor thing. And I thought it was really going to take a long time.
Does that matter if there's a cascade of other problems too, as well as this chronic pain issue?
Well,
Somebody's general health and in general matter to the treatment and the treatment success and everything?
yeah. Yeah, like I just had a patient yesterday who has just had some cosmetic surgery, pretty extensive cosmetic surgery, sort of all over the place. But she had a very interesting surgeon who, from what she told me, gave her a bunch of like pre-surgery things to do and supplements to take, and then post-surgery supplements to take and things to do. She spent 5 days in a hyperbaric chamber
Mhm.
after the cosmetic surgery. Plus, she was already in really good shape, right? And had a very healthy diet and really took care of herself. So when I saw her yesterday, she had just come from the surgeon who said, I've never had a patient heal this fast. And honestly, she looked terrific, and it had only been 2 weeks. I mean, it was really amazing, Why? Because she was in good shape. She took good care of herself. She took whatever supplements he had given her, and she had really taken it seriously. And she was reaping the benefits. I mean, I think in another few weeks, she's not going to have any symptoms at all.
When does your Chinese herbal war chest come into all of this and helping with chronic pain? And
It depends. So I just had a new patient a couple of days ago, and she said, well, what kind of herbs do you recommend? And this is another patient, so many things. Like there's so many. There's the neck pain and the shoulder pain, and there's numbness and tingling, and there's apparently she had some sort of brain injury, and it's very, very complicated. And I was like, this is too complicated for me. I said, we'll talk about the herbs next time. Okay. Because I want to see how she responded to acupuncture. I
Okay.
want to see if maybe we can peel that onion a little bit and kind of get down to, okay, what's the nut here? What's the real, more focused, more fine-tuned kind of accurate issue about what is actually going on here, because right now there's so much that it's like too much to really figure it out. But there are great herbs for pain. There's great formulas. Some herbal formulas in Chinese medicine are thousands of years old, and they still work. And
right.
so there's a lot of things that we can do. I like to give people formulas in general. But one of the things that you have to be aware of is you have to be aware, well, what's their underlying constitution? So, like, let's say, for example, the patient has digestion problems. They've got this pain problem, but their digestion system is pretty weak. So then you got to be careful, because you don't want to give them an herbal medication that might irritate their stomach, or you might want to give them a formula to strengthen this, and then just add a little bit to it for the chronic pain symptoms, right? You kind of have to fine tune it and also customize a herbal formula for each person.
So it's quite a science, the Chinese herbal formula thing,
Oh
right?
my God. And I'm not the most sophisticated herbalist in the world, that's for sure. I mean, and usually what I do is I take a pre-existing formula and then I add or subtract to it. But there are people way more sophisticated than me that it's really, I mean, it's really a beautiful thing. Chinese herbal medicine. It's really amazing. And the deeper you get into it, the more amazing it gets.
Okay, and then what about the other things that you work with? I imagine cupping is a good thing for pain, but what about, does it matter if the pain is localized, or is a channel problem elsewhere for the cupping? And just talk about that all.
Well, like I just had a patient yesterday
Okay.
who fell and broke her arm.
Oh.
And And it 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 was hard to figure out where she broke her arm. Like I wasn't quite positive that I understood where,
Hmm.
but it was somewhere in the upper arm. And now she's got shoulder problems, right? She's got reduced range of motion and pain and real restriction in the shoulder. And I saw her, she's getting better. It's slow. I personally thought she should have an MRI of her shoulder, and they're not doing it because they're like, oh well, we X-rayed your shoulder and everything looks great. Well, that's terrific, but that's showing us the bones. The bones are great. The bones are healing. They're fine. It's a soft tissue problem, and they are absolutely not looking at that. So there's nothing I can do about that. But it is getting better little by little. And so one of the things I did on her yesterday was, when I palpate, when I poke around, things were just so tight. And the rotator cuff, the posterior rotator cuff especially, was just so over the top tight that I ended up doing something called Gua Sha, which is where we take this tool that looks suspiciously like a spoon because it is a spoon, and it really breaks up adhesions and tightness and stuff like that. It kind of hurts a little bit, but it feels kind of good. And if you need to be gua sha, it leaves a mark. And so if I gua sha an area on somebody, it'll might get red, the skin will get red, but then like some darker areas will start to come up to the
It's
surface.
like the cupping kind of, right?
Exactly. And then it's like, aha, that's really where things are tight. And what she had was just all over her shoulder. It was just rigid. And then I actually had her sit up, and I actually did put a few cups on the bellies of the muscle themselves because they were just so flippin' tight. And then I used this stuff that I really like called Evil Bone Water that I don't know the name of the guy that made Evil Bone Water, but he is out there. You can Google it and buy Evil Bone Water. It's kind of great.
Okay, what about
for pain.
Moxa? And then what about Moxa for chronic pain?
Moxa is
and then,
great.
And then are you same thing as what that I asked earlier? Is the Moxa? Are you trying to just do general strengthening, or are you targeting the specific area of pain and the corresponding channel?
Okay, so there's a lot of good things in there. So Moxa is really kind of magical. So it's this herb, we light it on fire. There's loads of different ways of using Moxa on the body. In my but Moxa can be kind of smoky, and so in my office I have to be a little careful because I have neighbors and I don't want them, smelling smoke when they're in their offices. So I typically do something called indirect Moxa, where I have like a stick of Moxa that I hold over the acupuncture points or over the channels. So a couple things. One thing about Moxa is it's like a vitamin. So if the person has a chronic pain problem that in part is due to a deficiency in some organ system, Moxa is terrific for that because we can stimulate Moxa, different acupuncture points on the body that help strengthen the underlying constitution and the underlying organ problem.
So is it more for that than for the
No,
direct
no,
pain?
no,
Okay,
no, because you can also use Moxa because it's just so great for it's excuse me. Moxa is considered strengthening and moving.
So
Okay.
that's everything you want with
Well,
chronic pain, isn't
it's
it?
technically, it's really crazy. It's technically in the Materia Medica, it's a stop bleeding herb, but it says that it stops bleeding but does not cause stagnation. It doesn't cause the blood to stagnate.
Right.
It just stops bleeding. So you can actually use it internally for bleeding issues. But
And it's what?
but
That's a mugwort plant? Or is that
mugwort,
correct?
yeah.
Right.
So Moxa is really good for creating a little movement, for getting things in the channels moving again. It feels really good. So I often Moxa people that have like, let's say they have I have a patient that has chronic knee pain, and she's already had one knee replacement. She's got arthritic changes in her knees. Can I fix the chronic pain forever when there's all these arthritic changes underneath? Probably not. But what I can do is give her more good days than bad days. And that's, and like, she's walking so much better. She's got so much more mobility and she's so much more comfortable. But, there's a change in the humidity and then her knees hurt again, right? So then she comes back and then we do a lot of needles, but then we also do a lot of Moxa, which really helps.
Are these injuries that we are creating on ourselves, or are they just things that happen, or some of both?
I would say some of both. Um, what I see, and again, this is just my experience, I see a couple things. One is, just kind of lifestyle. Uh, Also, a lot of times, unfortunately, well, I have a I have a prejudice because I only see people that have had surgeries that haven't really solved the problem. I'm sure there are people that have
Yeah,
surgeries
they don't have a
that
need
are
to come see you,
very
right? Right.
successful and they never ever come to acupuncture. So the only people I see are the people that had problems where they had back surgery, they had shoulder surgery, or they had neck surgery and they've got all these problems afterwards. And maybe the surgery was a success, but now they have a chronic pain problem. So I have sort of a little bit of a twisted view because those are the people I see. I don't see the successes, and so I tend to think, surgery, it's
Yeah.
terrible. But honestly, it isn't, right? I mean, I had shoulder surgery. What was that? 12 years ago. I was in a bad horseback riding accident, and then I was in a bad horseback riding accident, and then I slipped and fell at Costco and broke my arm. Anyway, uh, my I had such a terrible shoulder separation, and the MRI just looked like a nightmare. And my left arm was practically 2 inches longer than my right because it was just sort of hanging off my body. So I ended up having to have surgery, and my surgery was very successful. My surgeon did a great job, and so you know that there's that. Um, so yeah, so I don't want to, say, oh, all surgeries are bad. I
Right,
just
right.
I tend to see people that where it hasn't been a good experience.
What about geriatric pain? And that's more from aging and just things
Well,
breaking down. And
of course I'm old now, so I feel like we have to live with the consequences of the decisions that we made when we were young, right? So when you're young, you can abuse your body a lot more than maybe you should, but I'll tell you, it tends to come and catch up
but
with
are
you
you dealing
later in
with that
life.
chronic pain in the same way as you would a
Uh,
35-year-old?
Good question. I would say no, it's a completely different thing. 35-year-olds have a lot more resources, right? There's a lot more, um, uh, it, things happen a lot quicker. Things resolve a lot
There's
quicker.
more elasticity and
Yeah,
recoverability.
exactly. So they have a lot more going for them. Once you get older, your muscles aren't as in as good a shape. You've got a lot more wear and tear, that kind of thing. And so with geriatric patients, usually it takes a little bit more time, but it also works. You also tend to work on older people differently than younger people. Like I've been teaching Chinese medicine for a long time, and it's so funny when the students start seeing real patients, like actual real human beings, they invariably think that like little old ladies or little old men, like, ooh, they're frail. I have to be really careful with them. It's like, no, you absolutely do not, because they don't have a lot of chi and blood in their bodies. So break out the big needles, because
Ooh.
if you use the little ones, they're not even going to feel it. Okay, they're not even gonna, and I even I remember this one old lady, and she was like, I don't know, in her late 80s or whatever, and she was like, you can get the big needles, I can handle it. And they can. And so, like, I would always tell the students, if you want to practice, like more of, like your deep needling techniques, or more of your, more aggressive tonification and reduction techniques, elderly people are the best person to do that on, because they're great. And they're like, go for it, whatever. So yeah, I mean, so it's like I tell people, if you want instantaneous gratification, go into pediatrics, because kids respond just like that. Like, you don't even have to insert the needle. Sometimes you just touch them
Yeah.
and they change. You know, Elderly people, they don't have a lot of chi and blood, so you kind of have to go looking for it. Like, where is it?
Interesting.
And you have to bring it up to the surface and get it moving, right? So you have to be a little bit more aggressive in your technique, and also needle retention. Where a baby, you might not retain the needle at all. You might just touch them with it. But with an elderly person, you might have to leave the needles in for 45 minutes or an hour.
Back on Tuesday.
Yeah, like, here, I'll come back later. Well, actually, there's a technique where you actually put the needles in and
Oof.
tape them, and they actually wear them home. But yeah, so it's a lot different.
Okay, and then what about disease-related chronic pain? Somebody with cancer, somebody with some other
Oh,
sort of
cancer's tough.
injury,
Yeah,
unsolvable injury, or I mean,
yeah,
how do you deal
cancer's
with that?
tough. Cancer's tough. So, we don't treat cancer in Chinese medicine. We absolutely do not
No, but
treat
you
that.
treat the symptoms and everything. So
We
what about
treat
the chronic pain
Yes,
from the
yes. So we
disease?
treat the side effects of the chemo or radiation. We try and focus on quality of life. So, cancer treatment can be pretty brutal. And so that's really the focus is how can we help people have the best quality of life while they're going through all this. And it can be really rewarding because, like, gosh, I mean, there's so many issues that people going through cancer treatments have to deal with. One being pain, um, neuropathy or radiculopathy,
Yeah.
numbness, tingling, that never goes away, gastrointestinal problems, sweating, burning, just all kinds of things. And so for that, that's kind of a different thing because with these people, we're not really looking for an underlying cause. We already know what
We
that
know it,
is.
right?
So what we're really doing is we're just treating the symptoms. So, like as a teacher of Chinese medicine, if I have a student that says, "Well, I'm just treating the symptoms," then I would say, "Well, then you're not doing Chinese medicine. You might be doing acupuncture, but you're not doing Chinese medicine." But actually, when you're working with that population of cancer people dealing with cancer, you actually are doing that. You actually are just treating the symptoms, and it can be extremely effective and
Interesting.
really helpful. But I always think of myself when I'm working on people going through cancer treatment that I'm one of a team. That there's a
Right,
team.
right, right.
There's the oncologist, and there's maybe the surgeon, and there's maybe the occupational therapist, or whatever. And I'm just doing my bit.
Yep. Question: should we ask our doctor or ask you when we come to see you or come to see them? Or
Oh boy. Well,
and it's so different than when we were young. God
yeah.
forbid you ask the doctor
Oh my
questions.
God. Well, one thing about medical doctors is that there are loads of good ones. And what you really need to do is find that good one, right? So, for example, one of the tools that they have in their toolbox for pain are injections. But injections have a real downside. And medical doctors in general tend to be what I would call pretty optimistic about injections and about how effective they are and about how many you can actually tolerate and still be healthy. So I would ask I would ask my medical doctor a couple of things. One is if they're asking you for injections, I would ask them, well, can you give me some data on the effectiveness of these injections 3 months down the road, 6 months down the road, 5 years down the road? Can you actually, or I mean, honestly, in this day and age, you can do
Find it
that. You can do it
yourself. Right,
yourself
right, right, right.
faster than you can with the
Right.
doctor. There's a website called PubMed, which is basically a library. It's a library of like every medical study on earth
Yep.
practically. And I mean, you can put in something like, steroid injections for knee pain and you'll get like 10,000 hits, but it's really good. Um, so yeah, I mean, I would ask them about the efficacy of the treatment that they have to offer. I would also suggest that even if they tell you you don't need it, you probably could benefit from physical therapy.
Okay.
Uh, because you got to move. And, physical therapists, I mean, I have problems with physical therapists in a lot of ways. One of the reasons that I do is because I find them to be kind of myopic. Like if you go in there with elbow pain, they look at your elbow and they don't look at the rest
Right,
of
right,
you.
right, right.
That's kind of what they do. But you can get some really uh, good ideas from physical therapists as far as exercising, and being as strong and as flexible as you possibly can. Um, I would also ask them about pharmaceuticals. I would ask them, okay, well, like, how long can I take this medication? What are the side effects? Do I have to take this for the rest of my life? Personally, if they said yes, I have to take this for the rest of my life,
That's a red flag.
I would be a little nervous about that. I would be like, really? Like, how much of a resolution can I expect? Um, and then if you go to alternative medicine, it's kind of the same thing. If you go to a chiropractor, if you go to a Chinese medicine practitioner, like what I like to give people is, here is my treatment plan. This is how long I think it's going to take. This is how many treatments I think you're going to need. I would like to do this, 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 and this. I'd like to give you an herbal formula. I'd like to do this. This is the part I want you to do. And for me, it's like, as a patient, I want to feel like I have a team. Like my doctor is on my team, and my acupuncturist is on my team, and my physical therapist is on my team, and these people are all helping me get as healthy as I can possibly be.
If only they all cooperated and acted that way.
Right. And in some places in the country they do.
Right.
But
we'll save that one for
so
another
much.
day.
Yeah.
So anyways, chronic pain can
Chronic
be
pain.
a difficult, debilitating, and challenging issue. And hopefully,
But there's hope.
What's that?
There's hope.
There's hope. So hopefully we gave you a few answers there, and a little look at the difference between East and West, and how Susan handles this when you come to see her. So I'm Scott. This is the In Medicine and On Medicine podcast. As always, this is Susan Wellman. She is an Oriental medicine doctor and East Asian medical practitioner here in the Las Vegas, Nevada Valley. Her information comes across the screen every so often. Hold on a second, superstar. Every so often, if you want to contact her with questions or to make an appointment, which you may also do in the comments section below. The stars of the show are Marty, the gray wired hair, and Leo, the black flat hair, brothers from the same litter. This is the In Medicine and On Medicine podcast. We will see you next time. Have a great day.
Bye.